Hello all, I wish you all good day. Today I'm going to deal with osteoporosis. Osteo, which means bone, porosis, which means multiple pores in the bone. So osteoporosis, it is characterized by loss of bone mass and deterioration of bone tissue, leading to fragility and risk for fracture. So what is osteoporosis? It is a musculoskeletal disorder which is commonly expected in old age, whereas it is characterized by demineralization of bones, or there are multiple pores which is generated within the bone. So what all are the etiological factors? Mainly the main feature is main causes postmenopausal estrogen deficit woman. So after menopause there will be chances to get osteoporosis. And chronic steroid use, the person who has been using steroid will be chances to, and that particular group, they are more prone to get osteoporosis. And the person who has been using alcohol, smoking and nicotine. So the consumption of all of these things causes or osteoporosis, or these medications or these substances will reduce the calcium absorption. And calcium deficiency can be occur as a result of decreased intake of calcium, or for the absorption of calcium the required vitamin is vitamin D. So deficiency of vitamin D will also cause this. And in case of certain disease, for example, kidney disorders or any parathyroid disorders, these disorder will also cause calcium deficiency. And in certain situations, it is called as malabsorption syndrome, where the calcium is not getting properly absorbed from the gut. That will also cause osteoporosis. And the causes, generally when we say that the genetic or family history, and the medication already I have explained, it is steroids and emotional stress and excessive use of alcohol, and the diet, which is sedentary lifestyle, smoking, hormonal imbalances, and inflammation and inflammatory process of the body, and environmental toxins, exposure of environmental toxins. And next we'll see what are the signs and symptoms of osteoporosis. On the right side, it is a normal bone, whereas in next opposite side, osteoporotic bone. Whereas in osteoporosis, there will be multiple pores within the bone will be seen. So what happens in this particular situations, because of multiple pores, the density of the bone will reduce, and it always causes lack of strength as well as pain. So because of lack of strength, there will be chances to get fracture. And the same way, the compression of the spongy bonds will also occur, and as a result of that, the backbone, which is a vertebra, will compress. Okay, as a result of that, the curvature of the bone will alter, and the body height will also be reduced. And the other signs are tenderness, fracture with a little or no trauma, loss of height over time. It is somewhat called as kyphosis. So loss of height or the forward curvature, it is called as kyphosis. And neck or low back pain will also be expected in this case. How do you manage? So you need to replace calcium. So vitamin D supplements, which can be obtained from sunlight or diet. The same way, vitamin D as well as calcium need to be replaced. Exercise program including weight bearing exercise, for example jogging, walking, jumping rope and aerobic exercise. That exercise will strengthen the muscles. Okay, if the bone is not strong, not much strong, still the muscles can compromise the function of bone. So we need to just strengthen the muscles. So in order to strengthen the muscles, these all are the exercises. And extreme exercise may be harmful for back involvement. Say for example flexion exercise, do not do that, because vigorous exercise will cause us chances of fracture. and a diet high in calcium need to be replaced. And the other management pharmacology such as calcium, vitamin D can be replaced, and take calcium with food as hypoacidity decreases absorption. So that is the reason. So always calcium can be taken with food. Implement safety measures to prevent fall. So assistive devices can be uh, given to the patient. Discuss lifelong diet rich in calcium. And these are the calcium source: milk, cheese, and other dairy products. Green leafy vegetables such as cauli, okra, and spinach. Soya drinks, and bread and anything made with a fortified flour. And fish where you eat the bone, such as sardine and pilchards. Okay, so these are the calcium rich food. And how would you manage as a medically for both men and women at they have the risk for fracture. So for those who have uh, the chances of fracture, you can replace calcium with biphosphonate. Example: alendronate, resveratrol, solidronic acid. Okay, so these are the certain examples. So the group is called as bisphosphonates. So this medications can be given to the patient in order to prevent fracture. So whenever you give bisphosphonate for the patient, you need to educate the patient regarding how to take this medicine. See, these medicines can be taken orally as well as IV also. Usually we give as orally. It need to be given in the early morning before food. And after taking this medicine, the patient need to sit for 30 minutes. Why? Because this medicine is causing esophagitis. So immediately after taking this medicine, if the patient lie down, there will be chances to get regurgitation as well as inflammatory. It causes inflammation to the esophagus. And the absorption of bisphosphonates are less in or through when we give orally. So it should not mixed with any food or any other medicine. So it need to be given on an empty stomach. So these are the certain things when we give this medicine. These all special precautions need to be educated to the patient. Okay, so this is all about osteoporosis, and this is frequently asked topic for all exam.